Today, I'm going to talk to you about letters of recommendation for residency training. I hope by the end of this presentation, you'll have been taught everything that you have always wanted to know about such letters. Letters of recommendation are obviously a huge part of your residency application profile, and so it's really befitting that we spend some time talking about them. So the objectives today, first to talk to you about how to earn a strong letter of recommendation, and I would emphasize the word earn. How to request a letter of recommendation from an attending, and then to give you some thoughts about what are characteristics of strong letters of recommendation. So one of the things that I'm asked a lot is, what can I do to earn strong letters of recommendation when I'm on U.S. clinical rotations? The comments that I'm about to make are very generic, and they actually relate to any rotation that you would be on. It doesn't matter if it's at an academic teaching hospital, if it's in a community program, if it's an inpatient rotation or an outpatient rotation. These are sort of like universal precautions, universal guidance for any student on a rotation. So first is really ensuring that you demonstrate respect and engagement. Maintain an appropriate level of formality with your attendings. So refer to them obviously as Dr. whatever their name is, and make sure that you conform to a professional formality. Now, you may see others on the rotation, for instance, individuals who are the senior residents, or perhaps even nurses that have longstanding relationships with a given attending, exhibit a sense of informality or less formal behavior with your attending. Please don't make the mistake of assuming that because you see others interacting with the attending in that fashion, that gives you the opportunity to do so. It definitely does not, and it's unless there's only one caveat, and that is unless the attending invites you to refer to them in some different fashion, which is really quite doubtful. Engagement. Interact with the people on your rotation, with your attendings, with your fellow students, with the residents. Demonstrate that you're interested in what's going on. Don't spend time on your cell phone. There is nothing more disturbing, distracting, and disappointing than having students that spend time on their cell phones during rounds, during resident presentation, really at any time. The only reason you should be on your phone is if you've been asked to look up a specific question and the answer to that specific question is found on some medical website and you're using your phone to access that site, or if you have an emergency phone call, which you have to take, in which case you tell them you have an emergency call and you step away. Those are the only two reasons you should be on your cell phone. And then maybe at the end of the rotation to snap some pictures with the individuals that you worked with as, as a nice memory. Showcase your initiative, your commitment to learning, and your dedication to improvement. Rotations are your opportunity to do these things and to sort of demonstrate that this is a quality improvement project for yourself. So when you have patients on the team, read up on them. Obviously, you're going to be assigned patients. You're going to hopefully read up on your patients and know every detail about their chart, their labs, their histories, their medical diagnoses, what they've done, what they haven't done, etc. But don't limit yourself to only your patients. If there's some other fascinating patients to you that are part of the team's patient, take advantage of them, read up on them. And not because you're trying to upstage another student. I want to be very clear, not because you're trying to do that, but because you're trying to, get some additional learning in yourself and recognize that some of the things that you read actually may be helpful to the clinical conversation during rounds. Volunteer to do short presentations on patient-related topics. I loved it when students would pick some topic on their own initiative. Something would happen. Let's say a patient on our service would have had an allergic reaction to a medication. And they would say, Dr. Parker, I want to read up on that. And could I prepare a short presentation for the team? And so the next day they would come in, they would have a one-page document that would be a summary of what they wanted to talk about. They would succinctly and very logically go through the topic in about 5 minutes. And at the end, guess what? We all had received education. The student was able to showcase their knowledge, their initiative, their commitment to learning, and their dedication to quality improvement. So those are kinds of things that you can do to enhance your position on the team. Speak up. You're going to be asked, probably, depending on the rotation, you might be asked to read chest x-rays or EKGs or help in some small procedure, interpret labs. Go ahead and try. There is nothing wrong with demonstrating that you're a student who is interested in learning. If you don't get it right, you don't get it right. It's okay. No one expects you at a certain level to be able to do these things with proficiency. But we do expect that you show initiative and that you're interested in trying. So push your anxiety aside and speak up. Requesting feedback at the midpoint of a rotation is something that really demonstrates maturity on an individual and demonstrates the fact that you want to grow. There is actually now in the competencies, a section in the competencies for residents which discusses their feedback, their relationship to feedback. And it talks about their initiative in requesting feedback, their receptivity to feedback, and their ability to take feedback and use it for their own learning. So when at the midpoint of your rotation, request feedback. It shows initiative and be receptive to what you hear, and then try to incorporate that feedback, which will subsequently demonstrate that you're somebody who really can do that. What else can you do to earn strong letters? Well, demonstrating reliability and integrity. I wish I didn't have to say this, but I do. Be punctual, arrive early, be ready to learn. Try to get a good night's sleep the night before so you really can learn well. Remember that arriving early sometimes has unexpected benefits. Your resident and the intern may be coming from someplace, some other obligation that they had, and the attending is sitting there, and you're the student, and you have an opportunity to engage one-on-one with your attending for a few minutes before the rest of the team arrives. Realize that some of those opportunities can be really precious. So be prepared, arrive early, and complete all tasks that you're assigned in a timely manner. There's really no reason, short of some illness, I would suppose, in a student not completing their tasks. And then, issues with truthfulness. If you're given something to do and you don't know how to do it, just tell them you don't know how to do it. It's always okay not to know things. What's not okay is to masquerade and pretend you know things when you don't. That will reflect very poorly on you and on your letter. Provide evidence you're a caring team player. Well, what does that mean? And I said caring team player. I didn't say caring student, because what I want to emphasize here, it's not just showing caring towards the patient. It's really being kind and helpful to everyone on the team. You're attending, the other students, the nurses, ancillary staff, whomever you engage with during that rotation. One of the ways that you show that you're a team player with other rotators is that while you're assertive, you're not aggressive in your behavior. When other fellow students are presenting, you don't interrupt. You listen to them in an active fashion and demonstrate your engagement. When there are questions that are posed on rounds, you let others have a chance to answer questions, even when you know the answers. And what I mean is that, yes, you're going to answer some questions, but you don't always have to be the one that answers all the questions. I recognize that there are many students who try to differentiate themselves by answering questions and demonstrating their knowledge. And sometimes they do to the detriment of themselves because in the way that they treat the other members of their team. So remember that you're part of a team during this rotation and that you have to be cognizant of that position. When other people do things that are wonderful on your team, compliment them. Compliment on them on their positive contributions, whatever that might be. Your fellow student does like a lovely presentation on a given topic. Publicly say, "I really enjoyed that. That was really great. You put together a wonderful presentation for us." Acknowledge others' excellence, others' work. It really is powerful, and it demonstrates your generosity and your maturity in being able to confer those types of compliments on others. How do I ask for a letter of recommendation? So I recognize that there are rotations that for which there is the sort of understanding that as long as you complete all the requirements of the rotation, you will receive a letter of recommendation. But there are letters of recommendation, and then there are letters of recommendation. And you obviously want the strongest letter of recommendation that you can possibly get. So I would say to you, it is important that you speak directly to the attending with whom you've rotated and discuss your letter of recommendation. Curbside them and say, "Could we talk briefly for maybe 10, 15 minutes? I wanted to talk to you about the end of the rotation and my letter." Honor their time. Help them in that meeting by giving them personal information that will allow them to give their letter some flavor. Give them your updated CV. Tactfully mention some highlights from your background. Let's say that you graduated from your program with distinction, or let's say that you have a particular really interesting volunteer activity that you've been doing for some time. Anything that you believe is going to enhance your application, try to talk to them about it briefly. Hopefully, they'll incorporate that into their letter of recommendation for you. You can't ask them to do that incorporation, but you can certainly give them some ideas about you. Discuss what you've learned on the rotation and that you have really appreciated their teaching. It's not about buttering up the attending, but it's also sort of a time when you can say, "This is what I've learned. This is what I really enjoyed about the rotation," which is also kind of meaningful to show how you've distilled your learning. You can remind them gently of how important the letter is to you and for your future, and be sure to thank them for their time and their willingness to help you on this really arduous journey. Finally, I would say please don't write your letter of recommendation for them. This happens at times. I hear every year that there are those attendings who ask the student to, if they would mind writing the letter, that they're oh so busy to write that letter. I do believe that puts you into a very difficult situation. But let me just say this, when letters are written by the students and then passed off as the attendings, it's often rather glaringly obvious because of the nature of how the letters are written. So I would avoid this at all costs. So what are strong letters of recommendation? Well, strong letters of recommendation are decidedly not letters which are generic. Generic letters are not helpful. Generic letters are such that they're oftentimes very easy to spot. We simply disregard them. Strong letters are specific, they indicate knowledge of you as an applicant, and strong letters are always on letterhead. Letters which are on blank pieces of paper without any letterhead really speak to unprofessionalism. And in general, when I would find those, I wouldn't even know what to do with them. Hopefully, there would be other letters that would offset that type of letter in a residence portfolio. So how do you ensure that you don't get generic letters? Well, I think that one of the most important things is that the clinical rotations that you're on allow you sufficient duration of time and sufficient contact with a given attending or group of attendings so that they actually get to know you and can write a meaningful letter of recommendation. If their contact time with you is very, very limited, they're really not going to be able to write such letters. Now, letters of recommendation typically do have some parts that are generic. For instance, the first paragraph of a letter typically introduces the attending. He or she tells a little bit about their position, how long they've been working with students and residents, and then we'll say something about the scope of the rotation. So that is standard letter language, and that will be the same for all rotators for whom that particular faculty member writes a letter. That's absolutely fine. And then there's the final paragraph, which typically is adjusted uh, adjusted for the endorsement of the student. I'll talk about that in a second. But most of the last paragraph is usually also a standard paragraph. So it's really those two paragraphs, one or two paragraphs that go between the first and the last paragraph that are really going to talk about you. And how are they going to speak about you that is going to convey your strength as an applicant? Well, they're going to use comparative language. So they'll say something like this rotator was in the top 5% of all of those students that has rotated with me over the past 5 years. Compare you. Give the reader a sense of where you fit in when they look at many, many other students. Strong letters use language which confers agency to the applicant. So it demonstrates leadership and achievement. And strong letters use certain types of language, specifically adjectives, that are strong. They use adjectives such as successful, excellent, accomplished, insightful, resourceful, confident, ambitious, independent. And they limit adjectives that are relatively weaker. Adjectives such as hardworking, dependable, dedicated, tactful, warm, caring. You want to use some of those. You want some of those adjectives, but you don't want a letter that says, student X rotated me and I found him or her to be a very hardworking student who was conscientious and followed through with her tasks. She was dedicated to learning and presented some nice presentations around. Her interpersonal skills were good. She was warm, helpful, and tactful to those around her. That type of a letter is a generic, poor letter that really will do you no good. In fact, it is a negative in your file. So it's important that adjectives that are used be strong adjectives. It's important, as I've already mentioned, that specific details of the applicant's performance and personal qualities are mentioned. It doesn't have to be many items, but it has to really speak to the fact that you know that applicant, you're aware of how they perform during the rotation. You can convey something, a specific incident, perhaps a specific presentation that they did, or a specific interaction with a patient that really was very impactful to you as the attending. The last paragraph is generally an endorsement of the student or not. An endorsement of the student where you indicate that this particular applicant, that you highly endorse that applicant, you endorse that applicant as a superior applicant, or that you simply recommend that applicant. There are many different gradations, but essentially we all know how to read through the language, sort of weak, average and superior candidates. And that is mentioned in the endorsement without specifically saying that. And then finally, every letter that is a strong letter really should have you having waived your rights to review. It just makes us feel that the letter is going to be more truthful. So when you meet with your letter writer, make sure that you talk to them that you have absolutely waived your rights to review. All right, well, that's really all I've got for you in terms of letters of recommendation. I hope this has been helpful. I hope taking you through some of the things you can do while you're on rotations to earn strong letters and then how to approach the attendings in ways that may increase the likelihood that they'll take maybe a little extra time and write just that much better of a letter for you. I hope those pointers were helpful to you. Thanks for joining me today. My goal at My Application Coach is to deliver meaningful content in bite-sized segments. I'd be honored if you'd hit the button below to subscribe to my YouTube channel and graciously provide your comments. I also invite you to check out my website, imgspecialist.com, where I offer personalized services assisting serious applicants with mock interviews, ERIS and personal statement review, and much more. Thank you.